Cardiovascular Pharmacology, Class 4, Antiarrhythmics, calcium channel blockers. All right, so we've covered pretty much all the antiarrhythmics. This is the last one. So just from the beginning, we have Class 1, which is our sodium channel blockers, right? Class 2 is going to be our beta blockers. Class 3 is the potassium channel blockers. And lastly, our Class 4 is our calcium channel blockers. We already discussed the calcium channel blockers, right, earlier on. And so we know the names of the drugs here, right? So this is diltiazem and verapamil, okay? And so you notice that, I don't know if you have or not, but we're only going to be using non-DHP calcium channel blockers for our antiarrhythmics, okay? Because those are specifically the only ones that act on the heart, right? The normal DHP calcium channel blockers, they act on the smooth muscle of the vessels, of the vasculature, and that's not going to be really helpful for antiarrhythmics of the heart. So this is why we use diltiazem and verapamil as our calcium channel blockers, okay? For our non-DHPs, right? This is very important to know. First step. Second step, it's going to be rate control. Rate control for atrial fibrillation. So that means our graph is going to look like what? It's going to be pointing towards our SA and AV nodal action potential graph, okay? Now, second thing, how is the graph going to change? It's going to elongate both phase 0 and phase 4 because it decreases conduction velocity from the SA to the AV node. Very easy, straightforward, boom. Elongates both phases 0 and 4. Perfect. And lastly, what you need to know is essentially the adverse effects. But we already discussed the adverse effects of verapamil and diltiazem. So the only thing that you really need to know about the adverse effects of non-DHPs is constipation. But that's it. They really don't ever ask about it. Just make sure you know that the calcium channel blockers are class 4 drugs, and they cause decreased conduction velocity via the calcium channel blockage. They're rate control for our atrial fibrillation, and they're going to elongate both phases 0 and 4 on our SA and AV nodal action potential graph.